Good day, so I will be performing urinary catheterization. This is Anzhela Eryn Ataiza of BSN 2C. Good day po, ma'am. I am your nurse for today, Nurse Anzhela Eryn Ataiza. For client identity verification, you are Mrs. Angel Garcia po. Am I correct? Yes po, nurse. So today po, I will be performing urinary catheterization. This is to relieve discomfort due to bladder distension or to provide gradual decompression of a distended bladder. This also assesses the amount of residual urine if the bladder empties incompletely, as well as to obtain a sterile urine specimen and to empty the bladder prior before surgery. So po, ma'am, to be able to participate during the procedure, I will just instruct you and will inform you on what I am going to do and how you would be able to participate as we carry on with the procedures. I already performed hand hygiene and observed appropriate infection control procedures. So before we carry on with the procedure, I have already closed the windows and doors and have established privacy. So I will now place the client in an appropriate position and will drape all the areas except the perineum. So we have here a female client. So we will position her with supine position with knees flexed and feet about 2 feet apart and hips slightly externally rotated if possible. So assuming that she is now in a supine position with knees flexed and feet apart. So for a male client, this goes with the same position, supine position, with thighs slightly abducted or apart. So we will now proceed to draping the client. We must drape the client in all areas except the perineum. So I already have established adequate lighting. So if I am right-handed, I will now stand on the client's right side. So if using a collecting bag and it is not contained within the catheterization kit, open the drainage package and place the end of the tubing within reach. So we have here the end of the tubing and we'll place it within reach. If agency policy permits, we must apply clean gloves. So we will now inject 10 to 15 ml of gel into the urethra of the male client. So after injecting the gel, we will now wipe the underside of the penile shaft to distribute the gel up the urethra. We have to wait at least 5 minutes for the gel to take effect before inserting the catheter. Then after that, we will remove and discard the gloves and perform hand hygiene. So now we will open the catheterization kit and will place a waterproof drape under the buttocks of the client without contaminating the center of the drape with your hands. And once again, we will apply sterile gloves. So now we will saturate the cleansing balls with antiseptic solution. Next is to open the lubricant package and remove the specimen container and place it nearby with the lid loosely on top. And now we will attach the pre-filled syringe to the indwelling catheter inflation hub. And now we will lubricate the catheter. For females, we have 2.5 to 5 centimeter, which is approximately 1 to 2 inches. And for males, 15 to 17.5 centimeters, which is 6 to 7 inches. So it's around this. And we will place it with the drainage end inside the collection container. Drainage end. If desired, we can place the fenestrated drape over the perineum, exposing the urinary meatus. So now we will cleanse the meatus. The non-dominant hand is considered contaminated once it touches the client's skin. So for a female client, by using the non-dominant hand, spread the labia so that the meatus is visible. Establish firm but gentle pressure on the labia. The antiseptic may make the tissue slippery, but the labia must not be allowed to return over the cleansed meatus. So with the dominant hand, I will pick up a cleansing ball with a forceps and will wipe one side of the labia majora into an anteroposterior direction. Then after one swipe on the other direction, we will now use a new cotton ball. Then lastly, we will use the last ball to cleanse over the meatus. For male clients, use your non-dominant hand to grasp the penis just below the glans. If necessary, you may retract the foreskin. Hold the penis firmly upright with slight tension. So lift the penis in this manner to help strengthen the urethra. Pick up a cleansing ball with the forceps in your dominant hand and wipe from the center of the meatus in a circular motion around the glans. Use great care that wiping the client does not contaminate the sterile hand. Always use a new ball and repeat 3 more times. So now we proceed to inserting the catheter. Grasp the catheter firmly 5 to 7.5 centimeter. This is 2 to 3 centimeter inches from the tip, and ask the client to take a slow deep breath and insert the catheter as the client exhales. So slight resistance is expected as the catheter passes through the sphincter. So assuming that we have inserted it, and if necessary, twist the catheter or hold pressure on the catheter until the sphincter relaxes. So we may now advance the catheter 5 cm or 2 more inches further until urine begins to flow through it. This is to be sure it is fully in the bladder and will not easily fall out, and the balloon is in the bladder completely. For male clients, some experts recommend advancing the catheter to the Y bifurcation of the catheter. Also, check your agency's policy. If the catheter accidentally contacts the labia or slips into the vagina, it is considered contaminated. So, a new and sterile catheter must now be used. So, for example, the contaminated catheter is left in the vagina. It can be left until the new catheter is inserted to help avoid mistaking the vaginal opening for the ureteral meatus. Always hold the catheter with the non-dominant hand. So here I am holding the catheter with my left hand. For an indwelling catheter, inflate the retention balloon with the designated volume without releasing the catheter, and for females, without releasing the labia, hold the inflation valve between two fingers of your non-dominant hand while you attach the syringe if it is not left attached earlier, and inflate with your dominant hand. If the client complains of discomfort, immediately withdraw the instilled fluid and advance the catheter further and attempt to inflate the balloon again. Pull gently on the catheter until resistance is felt to ensure that the balloon has inflated, and to place it in the trigone of the bladder. We will now collect a urine specimen. For an indwelling catheter pre-attached to a drainage bag, a specimen may be taken from this bag this initial time only. So we can collect specimen from the bag. Now we will allow the straight catheter to continue draining into the urine receptacle. If necessary, attach the drainage bag end of an indwelling catheter to the collecting tubing and bag. So now we will examine and measure the urine. In some cases, only 750 to 1000 ml of urine are to be drained from the bladder at one time. Check agency policy for further instructions if this should occur. For an indwelling catheter, secure the catheter tubing to the thigh for female clients, or the upper thigh or lower abdomen for male clients, with enough slack to allow usual movement. This prevents unnecessary ureteral trauma. So now we will wipe any remaining antiseptic or lubricant from the perineal area. Replace the foreskin if it is retracted earlier for male clients. Now return the client to a comfortable position and instruct the client on positioning and moving with the catheter in place. So now we will discard all used items in appropriate receptacles. We will now remove and discard gloves. And after that, perform hand hygiene. Lastly, document the catheterization procedure, including catheter size and results, in the client record using forms or checklists supplemented by narrative notes when appropriate. That is all. Thank you for watching.